Did you know that 24% of patients admitted to the hospital with heart failure are readmitted within 30 days?
Hey doc, I've been taking these beta blockers for a long time for my heart failure and they're not working for me anymore. I was wondering if there are any new meds that I could try out.
I'd like to prescribe you a drug called Ivabradine or Corlinor. It's indicated for patients with worsening symptomatic heart failure who don't respond well to beta blockers, like you haven't been. It can help reduce the risk of you being rehospitalized so you don't have to come back here to the emergency department.
How does it work?
So, your heart has an internal pacemaker known as the SA node, and Ivabradine works by slowing down the rate of the SA node so that your heart rate decreases. When your heart rate decreases, then your chambers of your heart, or your ventricles, they can fill with more blood, and then that way, each time your heart beats, it can pump out more blood to the rest of your body. This is known as ejection fraction, and so Ivabradine increases your ejection fraction along with decreasing your heart rate.
Wow, that sounds really great. Maybe I can get back to how I used to be.
I think that Ivabradine will work a little bit better than beta blockers for you, Steve, because beta blockers decrease your heart rate, but they also decrease cardiac contractility, which is the amount of force that each heartbeat has behind it, or the force behind the muscles. Ivabradine decreases heart rate without decreasing cardiac contractility, so we can have decreased systemic side effects as well as increased symptomatic relief for your heart failure.
Oh, that sounds interesting, Doc. Can you tell me about the side effects?
Good question, Steve. Some side effects that you need to be aware of when you take Ivabradine include low heart rate or bradycardia, high blood pressure or hypertension, a cardiac arrhythmia known as atrial fibrillation, in which the top chambers of your heart beat out of sync with the rest of your heart at an irregular rhythm and oftentimes a really fast rate, and also visual changes in your eyes.
So what are some things that a nurse like me should consider when giving Ivabradine?
So there are a couple things for nurses to consider before administering Ivabradine. If the patient has a heart rate lower than 60, you want to hold the drug because you don't want them to become severely bradycardic. You also want to hold the drug if they are hypotensive, as this can exacerbate their hypotension. The patient should be in normal sinus rhythm on the EKG, as this affects the pacemaker of the heart, or the SA node, and you don't want to cause any cardiac arrhythmias or exacerbate any cardiac arrhythmias. And with that, the patients who are receiving Ivabradine should not be on a pacemaker. If they have a pacemaker, then they cannot receive Ivabradine. Be cautious with patients with hepatic impairment, as the drug is metabolized in the liver, and if the patient experiences the adverse side effects of visual changes, then you want to make sure you implement safety precautions so that the patients don't hurt themselves.